my name is Brittany Jackson and I'm in Section 8 and this is mini bag administration. I'm going to start out with looking at my doctor's orders, and I see that my doctor has ordered Flagyl via IV 500 milligrams every 6 hours, and I'm going to determine the milliliters I need to give by looking at the Flagyl bottle, and I see that it's 500 milligrams per milliliter, so I'm going to give 1 milliliter. And I'm going to determine the drip rate, and it's 10 drops per milliliter, so that would equal out to 17 drops per minute. And now I'm going to draw up my saline, which I'll need later for a flush. I'm going to draw up 6 milliliters of saline in a 10 milliliter syringe. First, I'm going to inject the air. And I would first clean this off, and I would make sure to check the expiration, and I would have performed hand hygiene. Throw this in the sharps container and save that for later. And now I'm going to draw up my Flagyl, 1 milligram, or 1 milliliter, I'm sorry. I'm going to wipe this off again. Switch the needles on this, and now I'm going to insert the Flagyl into the bag. I would go ahead and get another alcohol wipe and wipe that off. Check the medication into the sharps container, and I'm going to mix my medication, and then I'm going to label my bag with the client name, the drug name, the dose, the time, and my initials. And I'm going to have that ready for the client's room. Alright, so now I am ready to go into my patient's room. I have my tubing ready. Knock on the door, perform hand hygiene, and I would go ahead and put on my gloves. And I'm going to go ahead and take out my tubing. make sure to check my patient's name and date of birth when I go in. And I'm going to tell them the procedure that I'm doing and ask them if they have any allergies. And I'll let them know that they're getting Flagyl and that it's going to help with their infection. And I'm going to go ahead and spike the bag. And this is still sterile, and so is this. I'm going to pop that off and go ahead and spike it. And the other part's still sterile. And at this point, I'm going to check the patient's arm in the IV site, make sure that it's patent and no redness or swelling. Ask the patient if they're in any pain. And I'm going to take my 6 milliliter saline, but I'm going to only flush it with 3 milliliters. I'm going to unclamp. And use my alcohol wipe to clean this off. And attach that. And I'm going to aspirate for blood return, and use the push pause method for 3 milliliters. Prime my tubing to get ready to attach the medication. I can get it untangled. Make sure this is unclamped. Unclamp this. Take the cap off. I'm going to fill this about halfway. Attached to my patient. I'm going to take an alcohol wipe and re-swab their IV site. Unclamp this and unclamp this, and I'm going to count my drip rate so that it's 17 drips per minute, which is the drip rate factor we had calculated earlier. Alright, looks good. I'm going to check the site again. My patient's not in any pain, no redness or swelling. Looks to be going in good. Okay, and gather all materials, leave the room. And I come back in when the medication was finished, and I actually had forgot I need to label the tubing as well with the date, time, and my initials. So I would have done that. And now that I'm back in the room, the medication is finished. So I would go ahead and clamp it off. Clamp this off as well. Undo that. the rest of my saline. I also would have performed hand hygiene when I came back in. Washing this off. Attach the saline. Aspirate for blood return. Okay, have some blood. And use the push pause method to do the rest of these 3 mils of saline. Make sure it's unclamped now. And I will reclamp at the end of this saline. And take that off, dispose of that. Check the site again. Looks good. Ask the patient if they're in any pain. And that's it. Oh, and I would also document my use of the MAR, the time, the drug, the dose, the route, the condition of the IV site, how my patient, my patient's reaction, and the amount of volume used, the amount of fluid. And that's it.